executive order for the National Guard for up to 2,000 troops. That is just so we can have the resources we need when we need them. I haven't, had any big plans to call up a bunch of troops at this time, but we have used a few here and there with deliveries and other things that we've had going on around the state. So that is just being a little forward thinking there, not to get bogged down in paperwork should we have something and we need to deploy in the middle of the night, or pick somebody up or move something, or help with security issues or what have you. The public health emergency, as you all know, we spent a lot of time talking to the General Assembly about this, but it's really dealing with this unique situation that we're facing in our state, historic in a lot of ways. First time we believe it's ever been used, but it will help us face issues that we're starting to see, and I think that we will potentially see, depending on where this thing goes, with medical supply shortages. Certainly hospital bed space is a serious concern, probably one of my biggest that we are worried about as we continue to see the escalation in cases around the state and get more testing done. We are moving along on testing, as we reported to you last week. By the end of this week, we should have been able to double our testing capacity at our state labs to 200 a day. We're also working with FEMA to establish a FEMA state partnership for independent sites in every region of the state. That's 18 different health districts. So we are diligently working on that. I'm not exactly sure when all that's going to be completed, but that is actually under ongoing right at this moment. So we'll keep you posted when those start to become online and where they are, and when we think the completion date will be, when we have a better handle on that. I also want to continue to call on people to follow the social distancing orders that we've seen from CDC. Continue to avoid large events. Please stay at home. If you are sick, continually wash your hands, use hand sanitizer, and certainly be very protective of the elderly and the chronically ill, because they are very much more susceptible to this virus than most people are. I'd also like to encourage Georgians, like we did today, to support their local restaurants and drive-throughs. We brought some lunch in from the Varsity today. We certainly appreciate folks like the Varsity, Chick-fil-A. I've seen McDonald's, Buckhead Restaurant Group, a lot of other creative people in our state that are coming up ways to, I know Waffle House is doing this as well, to incorporate social distancing in their establishments to help protect their workforce and to keep our citizens safe, but continue to hang on in a really struggling economic environment that we're facing and are going to face in the days ahead. So I want to encourage all Georgians to support their neighborhood businesses and those folks that are here that are great supporters of our community. And we got to buckle down and support each other and get through this together. As you guys know, late yesterday afternoon, I put the order out to have all public schools closed. Today will be the last day that classes will be held. That's for elementary, secondary, and post-secondary institutions in our state. That will run, that'll be enforced tomorrow, so no classes tomorrow. And then that will run through the end of the month. I have worked with the School Superintendents Association, the Georgia Association of Educational Leaders, and certainly have been in conversations with Chancellor Wrigley and Commissioner Dozer for the university system and our technical college system in making that decision. And we have set that for the end of the month. We'll continue to watch that very closely and see what the trend lines are to see if we need to take further action or not. But we will do so in a way that gives people plenty of time.
What I thought I would hear today, John, was actually a little bit more of an aggressive stance towards these social distancing things. Really recommending that people.
Hello. Sorry about that. I'm not sure who that was. So anyway, we'll continue to work with the locals and communicating and coordinating in regards to school closures and things of that nature. I did just want to update you real quick. On the isolation facilities at Hard Labor Creek State Park, we have 7 trailers, as you all know. We have had one individual that has left that site that's been well documented by the media, and we now have a new patient on site. There is just one. We're also working on the new site, which has been reported several days ago, for 20 trailers down at the JIPSTIC, which is the Georgia Law Enforcement Training Center, and for Forsyth, Georgia, Monroe County. That space, if the weather holds, should be up and running with trailers by the end of the week. And I want to certainly thank the folks at JIPSTIC and GEMA for getting that done very quickly, or almost getting it done. It'll be done relatively fast now. Department of Public Health update, and I'll let Dr. Toomey speak to this when I wrap up, but we've got, as you know, 146 positive cases in our state. That's now in 27 counties. That's up from 121 counties, or 121 cases yesterday, and 23 counties yesterday. So we went from 121 to 146 on the positive cases, and we went from 23 to 27 counties. As you all know, CDC issued guidance strongly discouraging gatherings of 10 plus people. On the GEMA Homeland Security front, and Homer Bryson can speak and answer any additional questions you have when I wrap up as well, but we received a shipment from the Strategic National Stockpile yesterday. We also have medical supplies on order. Homer updated us with that this morning. We've ordered over 100,000 masks, 10 pallets of medical face shields, 10,000 gloves, 25,000 gowns, 26,000 shoe covers, 1,000 goggles. We are unsure of the delivery date at this time. As far as the National Guard, I wanted to give you an update on Dobbins, where our visitors from around the country still reside that were on the Princess cruise ship. All Georgians have left that facility. That happened on Sunday. They are back home in self-quarantine, being monitored by their local health department. There's 124 people that are scheduled to leave that facility today and go back to Illinois, Indiana, and Delaware. As was reported, the total number that we had when we started was 487. So that leaves around 160 people at Dobbins. And again, there are no Georgians there. I also want to thank GEMA, General Carden, and the National Guard, and the Cobb County Chamber of Commerce, and John Loud for their quick action to get care packages for our visitors from other states to help their stay a little bit easier. The Cobb Chamber really stood up very quickly with care packages, and I know we got some good social media posts and texts from folks inside the facility thanking thanking us Georgians for helping them in a time of need, and we were glad to do that. John Zeldin updated us today on the Atlanta International Airport. As international flights from hot zones arrive, airport officials screen people on the plane before disembarkation to prevent groups congregated in hallways and corridors. I want to applaud the airport on all that they've done, the strategic things that they've laid out, and the way they're handling these folks that have been coming back in. It's been a very seamless process compared to other places around the country, and I certainly congratulate John and his team there, as well as the hardworking folks from Borders and Customs and TSA agents and other people that are dealing with that situation. The passenger ridership, or the passengers in the airport, is down 40%. The airport ran the airport yesterday ran 2,400 flights. Today, the airport will run 2,200. The TSA agent who did test positive for COVID-19 is now in quarantine. Also, they've quarantined any potential contacts, disinfected the area in the airport, and they are feel like they have that situation in hand, which I certainly applaud them in that regard. John was also telling us that he's having some issues with TSA agent no-shows, which is certainly understandable in this environment. And we will continue to let our federal partners know that. Attorney General Chris Carr gave us a quick update today. They have seen an uptick in price gouging reports. They've had 29 cases overall. The biggest categories were with food and water at groceries type store, retail outlets. The majority of those cases were received yesterday. We're hearing that some sites, we're also hearing some interesting thing about testing for the coronavirus, with certain sites charging up to $300 for the test and the mail-in fee and getting the results back. I would just encourage Georgians, if they feel like they need a test, to please call their doctor and get that information and work out the protocol for doing that. Certainly people can pay for individual tests if they would like, but the information that's coming from their doctor, from the Georgia Department of Public Health, and other government agencies is really the best place to learn about who needs to be tested and where you can go to do that to make sure that you're not being taken advantage of. The University System of Georgia and the Technical College System of Georgia, I want to thank Chancellor Wrigley and Commissioner Greg Dozier for their work in collaboration with us with the order on the schools yesterday afternoon. They are moving to all online courses through the end of the semester, except for students who need in-person experience, which an example of that is clinicals that they are doing in a medical setting per se. So I appreciate their work on that. We continue to work with them on how that's going to look and help them get that implemented. I want to thank State School Superintendent Richard Woods for all the work that he's doing as well to communicate with the local educators and education community around our state. As he mentioned, Superintendent Woods had suspended the milestones testing for the end of school year test and suspended attendance requirements for schools. And I applaud him and support him in this. This is something that we are hearing from the parents and the school administrators, and we'll continue to work with them under this very abnormal circumstance that we're in right now, unlike really anything we've ever seen. And we're just going to have to work our way through it, and we'll do that. And we have a great team that thankfully is all working together to do that. I did just want to mention a few other things. The Atlanta Emergency Management, as you all know, the city has fully implemented telework policies, much like we've done at state government. We also have had a lot of questions about the SBA or Small Business Administration loans. Lots of constituents inquiries on this program. I'm proud to say that Georgia has finished the paperwork to submit the SBA, and that process is underway. So I certainly want to thank everyone for their fast work on that, especially Homer Bryson, and Homer can answer any more questions on that. Senator Ben Watson, who is a medical doctor in the Savannah, Georgia area, reported on the conference call that federally qualified health centers are establishing drive-throughs or tent sites across the state, and they are using LabCorp to do that. So that's good to hear that we have, other testing that's popping up around the state. Representative Sharon Cooper also shared a few points that she was hearing yesterday when she was at the Capitol about long-term care facilities having staffing issues in regards to child care. We are certainly very well aware of that. We know that the industry has taken some very unique and innovative approaches to that, with some of them standing up nursing homes on their facilities and other creative things. And we'll continue to keep our ear to the ground on that. I mentioned a little bit about the PPE, the personal protective equipment, and the orders that we have. We continue to hear not only around the state, but around the country of the shortage, but I can assure you we have the full force of the task force and our team with our Insurance and Fire Safety Commissioner, General John King, who's chairing that preparedness task force. General Carden and Homer Bryson at GEMA, all of them are working very closely with Dr. Toomey and DPH on supplies. We actually have the State Patrol and GEMA that are delivering those so we can get them there fast if the need is critical, which we have already done in a couple of instances. And I want to thank the State Patrol and GEMA for their cooperation in that regard, as well as the National Guard on many other issues. But we're going to continue to work on that shortage. We've got a lot of people focused on that issue. Also, just wanted to wrap up and let you know that later today, I've got 2 other different calls with the Georgia Municipal Association, as well as the Association of County Commissioners of Georgia, to continue to talk to them and learn more about what they're facing at the local level. And then us also kind of giving them, our thoughts on things and just continuing to collaborate. We're all in this together. We need everybody spreading the message about social distancing and limiting folks where they're going. Talk about creative ideas that people have to keep their economies going, but also keep their patrons safe and their workers as well. And so I look forward to those calls here later today. And with that, I'm going to turn it over to Dr. Toomey for an update, and then we'll have Homer come on right after her with GEMA.
Thank you very much, Governor. Probably the most questions I've gotten over the last several days is about testing. What is our testing capacity? Who needs to be tested? And how do I get a test? Somehow I disappeared, but I'm just going to keep talking. I hope you can still hear me. You may remember when this first state.
Dr. Toomey.
Yeah.
Hey, this is Brian. We can see you and hear you, so just go right ahead.
Oh, good. Okay. Thank you so much. When this first began in January, the only testing capacity in the country was through CDC. And we began a number of weeks ago at the Georgia Public Health Laboratory. Since that began, we have tested over 420 individuals, and we will be increasing the capacity to test additional individuals over the next several days as we continue to get additional equipment and additional staff. Also, remember that LabCorp and Quest are also doing testing in our state. So we have the potential to send test materials to be tested to private laboratories as well. And we're using all those capacities statewide. We have been working in partnership through the task force with Emory. They will have rapid testing available shortly. And we are hoping that we can develop those linkages. Need test back quickly with this new equipment that's very fast. We can use their capacity as well. When this first started, we had to follow CDC guidelines, which really limited us to individuals who had traveled. Since that time, we have recognized that we have to expand our criteria for testing, but we don't have sufficient testing capacity to test everybody who has mild illness. And we also know that 80% of individuals with COVID-19 don't have very, very mild symptoms and don't require intensive medical care and can be managed safely at home. With that in mind, we are working closely with the medical community to ensure that we keep individuals from flooding emergency rooms or primary care practices, that we don't expose others in the emergency rooms, don't expose others in primary care practices, and set up testing capabilities in all of our health districts so that we can ensure that those who need it, and I'll talk about that in a minute, but those who most need testing have access to testing either through their private provider or through our testing sites, which are being developed, we hope will be up within the next several days. The guidelines that we have received from the Centers for Disease Control and Prevention emphasize that it's very important to prioritize for testing those who are not only most at risk, but also are most important in the community to allow us to respond. And so that includes healthcare workers, that includes emergency responders, such as police, fire, and others who are needed in the community, EMS drivers, and others who are needed in this response, those vulnerable individuals who are at high risk because they may be elderly, have chronic health conditions, individuals in nursing care or senior centers. Those individuals and their caregivers are at high risk for us to follow up for testing. Again, please, if I can get through one message, the most important thing is don't just go to your emergency room or primary care provider for testing. Work with them. They can coordinate with us to either do the test within their facility or can work with us as we set up these drive-through testing facilities or other fixed testing sites throughout the state. We hope that we will ensure that we get these guidelines out to all providers so they realize that we have this capacity. But we also want to reinforce the fact that not every individual who wants to be tested can be tested because of limited capacity. But this is safe. This is actually the guidance that we are getting from our federal partners. We want to test those individuals at highest risk and can continue to work with individuals in the community, managing them at home, monitoring them as we have many of our patients already safely and easily without risk to the community or to them or their families. And at that, I'll stop and let's let Mr. Bryson or others move on.
We're going to see if he can unmute himself and if we can hear him. All right, so apologies on that. I know we're experiencing some technical difficulties, as you can
Cody,
imagine.
I'm on.
Okay, go ahead, Home.
Sorry for that. We've been working with the governor's office and the Department of Public Health for several days now, and identified several objectives that are priorities for all of us. First was to develop, deploy, and monitor a statewide COVID-19 testing plan, coordinate with local officials to provide needed resources, and prioritize the delivery and support as required. Develop and administer the strategic national stockpile distribution and resupply plan in support of statewide medical providers, and construct a COVID-19 isolation site at the Georgia Public Safety Training Center with a capacity of 20 trailers. I'll start with the last one first. That project is nearing completion, and with a little bit of luck with the weather, we should be able to move those 20 additional trailers in the end of this week. It was mentioned earlier that we have received a shipment from the Strategic National Stockpile, so that process is working and moving forward. And we have, the governor mentioned a lot of the supplies that we have on order. The supplies that he has mentioned are all coming from private vendors. And I will just add to that, in addition to that, we have made a request through FEMA for 15,000 specimen collection kits, 5,000 personal protective equipment sets, and 36 U.S. Public Health Services officers. And that concludes our report.
And thank you, Director Bryson. I think we have addressed most of the questions that I received via email, at least by topic. So if there are follow-ups that folks have, everyone has my email, but I'll go ahead and read it out. It's just cody.hall, Hall, @Georgia, spelled out, .gov. And please email me those follow-ups, and we will try to get you an answer as soon as possible. Again, just a FYI, you know, a lot of these questions we have to refer to DPH and some other state agencies to try to get those answers. So please give Candace and I enough time to get that information for you. But again, thank you for joining the call. And I think we're going to go ahead and end at this point. And again, please send those follow-ups if you have them. Thanks.
Thanks, everybody.